Okay, this is slideshow number 2, and we're just continuing on. Every facility has to have a blame-free approach if they are a joint commissioned accredited facility. Okay, and this just means that it makes it possible for self-reporting of the nurse. Maybe there's just a flaw in the system, or maybe a little bitty thing that you just need re-educated on. And this makes nurses more likely to report their errors. Okay, so we also have to encourage our family members to be safety partners and have the kind of relationship that they will not be afraid to say, hey, the last time my mom got her antibiotics, it was a much smaller bag. Did she get changed or something? Don't be offended by these kinds of things. Our families need to be brought in as partners in safety, in our culture of safety. Right? A sentinel event. A sentinel event is just a really severe variation in the standard of care, and it's caused by human or system error, and it's something that results in an avoidable, and that's the key word here, an avoidable patient death or major harm, or potential death or major harm. Okay, so the facility that is a Joint Commission accredited facility must report these to the Joint Commission, and they have to do a detailed root cause analysis, which is not a small undertaking, okay? As well as they have to come up with a corrective action plan, so that what are we going to do so that this sentinel event never happens again in our facility? Right. So examples of the most commonly occurring sentinel events include unintended retention of a foreign object. So that's going to be your surgeries where something is left inside the patient. Falls are a major cause of sentinel event. And that's why we are so careful to make sure that our patients do not fall in the hospital or in wherever we're working, nursing home or whatever. And performing procedures on the wrong patient. Can you imagine going in for an appendectomy and you come out without your left leg? I mean, that would be a major sentinel event. That's why we do timeouts in surgery before everything gets started. And if you will do these correctly and really take them seriously and pay attention, these kind of errors can be avoided. So medication errors also kind of rank up there as well. Those can cause very serious harm to the patient. So we need to make sure that we're doing our rights of medication administration, checking our armbands, scanning like we're supposed to, so that we can avoid a sentinel event. The interprofessional healthcare team consists of the patient, the family, nurses, unlicensed assistant personnel, and any other healthcare professional or assistant that works with the patient. This might include x-ray, OT, PT, and pharmacy also. Even though they usually are not directly hands-on with the patient, they are involved in their care. So there's an expert panel that's called the Interprofessional Education of Collaborative, and they publish some competencies to guide healthcare professionals in education and practice. The IPEC is a unique partnership of 6 different associations. There's the American Association of Colleges of Nursing, the American Association of Colleges of Osteopathic Medicine, the American Association of Colleges of Pharmacy, the American Dental Education Association, the Association of American Medical Colleges, and the Association of Schools of Public Health. So these competencies are things that we need to practice and get good at in order to take the best care of the patient that we can. We should have the values, our ethics in practice. to work with the individuals of other professions to maintain a climate of mutual respect and shared values. And this goes back to communicating and setting up appointments and different things for our patients outside of the hospital setting, okay? So we have to use our own role to assess and address the healthcare needs of our patients or populations served. We have to keep up our end of the deal. Each area needs to keep up their end of the deal. So even if you're a dentist, we're sending our patient to you because they keep having or they've had a major infection due to a dental problem. You know, the dentist needs to be professional and collaborate with us so that we can get the best care for this patient. We have to communicate in a way that is not only responsive, but also responsible, that supports a team approach to the maintenance of health and treatment of disease. So, in other words, don't badmouth other professions. Just don't do it. It's not professional. Be a good team member. Work well with others so that you can provide safe, timely, efficient, effective, and equitable or fair and impartial care for the patient. How many of you have heard of SBAR communication? I know that you have. You should be using this in your shift report, bedside report, when a patient goes for a test, upon discharge, when making appointments or arrangements with other agencies for the patient's care. Okay, so let's go over the SBAR a little bit. The S stands for situation. What is happening at the time that you're having to have this conversation with somebody else? What is happening? B stands for background. What relevant background information do you need to relate about this patient and their situation? This might be things like about their health that's relevant, their health histories like allergies, if they're a diabetic, etc. These are limited things, though. You don't need to tell a whole patient history when you're giving the background. Just things are relevant to their current care. Okay. A stands for assessment. You're going to provide an analysis of the problem or patient need based on assessment data. So what have their vitals been today? You might say they might need another blood pressure medicine added. How has their pain been? I noticed their lungs are sounding more wet today. Output has been okay, but they may need Lasix if it gets much worse, etc. And that kind of segues into recommendations and requests. State what is needed or what the desired outcome is. So you might say, Dr. Martin wants her out of bed 3 times a day, but she's so weak, we probably need a PT eval. Okay? So you're going to recommend or request certain things. And I just noticed that I have 2 R's on recommendation. I guess that makes it really important. But okay. Let's talk about team steps. Team steps are tools that you use daily to help elevate your performance as a nurse and to aid in patient safety. All right, so some examples would be cuss words, that's C-U-S words. And these are words like, I'm concerned, I'm uncomfortable, I don't feel like this is safe. All right, those are the 3 things that you're going to focus on when you talk about cuss words. I'm concerned that this might not be the right treatment for the patient. I'm uncomfortable giving this patient so-and-so med. I don't feel like this is safe. Okay? If you feel comfortable saying these things, it will definitely better your performance and absolutely increases the safety for the patient. Another example of steps or a step tool is checkbacks. So what that means is you're going to restate what you think you heard the patient say or mean. And this can go for physicians interaction, nurse-to-nurse interactions as well. This eliminates all the confusion and misunderstandings. So if the doctor says, I want you to give this Miss Jones 20 milligrams of Lasix twice a day, you might restate back to him and say, okay, so you want me to give her Lasix 20 milligrams 2 times a day. And that way there's no ambiguity about what's going on with the patient. Okay? Another tool that you can use is call outs. Shout out important information for all team members to hear. So this is usually in a code situation, and we need to be verbalizing all that we're doing, or even an emergency situation where the patient has not coded yet. So vitals, maybe. You may be shouting out the vitals. You might say, okay, ET tube in at 0705. Last epinephrine given at 0710. Placed a 20 gauge IV in the right hand. I mean, just whatever it is. You call it out so that communication between all individuals in the room is good and everybody knows what everybody else is doing. Okay, so that doesn't mean we talk over people. You have to be careful about doing that. Make sure it's a time where you can input your information where everybody can hear it. Okay. Also, you can use the 2 challenge rule. This means that you state a concern twice as needed. And if that concern is ignored, then you follow the chain of command to get the concern addressed. Yes, it happens, and yes, I've done it. So I had a patient going bad, and I called the doctor twice and practically begged to do an ABG because the patient was having trouble and it kind of looked like he might need to go on the ventilator. So the doctor refused. So I ended up having to call the ICU physician director, which every ICU, every floor will have a director. Now, this was after I had already gone through my manager, everybody that I could before I called the ICU physician director. So you go directly up your chain of command. And anyway, the ICU physician director called the doctor, got things rolling. We got an ABG, and the patient was immediately intubated. So if I hadn't gone on and gone up the chain of command, we would have had a code blue situation instead of a more controlled intubation. Okay. All right, we're going to cover delegation some more. You having been LPNs working with UAPs under you gives you an advantage because you're familiar with the role of each person already. My sister is an LPN. She's a very, very good one. She worked for a while in a nursing home. So we have to remember that we are accountable for any task or activity that we delegate to someone else. There always has to be guidance on how the activity is to be done. Then you have to evaluate the activity and follow up on any tasks that need to be done. So supervision is guidance or direction, evaluation, and follow-up by the nurse to ensure a task or activity is performed appropriately. So I told you about my sister because I wanted to tell you about a time in the nursing home when she was having trouble getting the UAPs to change the patients in a timely manner. And she felt like they were probably not telling the truth about different things. And so what she said was, okay, let's go in here and change we'll say Blake. Let's go in here and change Mr. Blake. And so they changed Mr. Blake, and then with the UAP present, she wrote the time on Mr. Blake's diaper. Okay? So she's not trying to trick the UAP, not trying to get the UAP in trouble. She is just making sure that Mr. Jones is going to be changed. So that's just an example of some follow-ups and some different things that you can do. And that will help you take good care of your patients and making sure that the things that you're delegating are followed up on. Okay, so here are 5 rights to delegation. You have to be familiar with the scope of practice for yourself and the people working under you. Are you in the ICU with a critically ill patient that's fragile and prone to aspiration? You might not want to delegate feeding of this individual to a UAP, although you usually would. That is something that they usually would do. In this case, you might want to do it yourself because you need to, not because that they can't do it and be careful and make sure they don't aspirate. It's so that you can evaluate how bad is their swallowing. Are they aspirating? Do I think they're aspirating? It's an assessment process, really. And you have to think about, have you seen them do the activity that you're about to delegate to them and you know that they can do it? Have they been through the checkoffs at your facility? These are all important things to know. So you always need to be precise and clear when delegating. For example, you might say, Sally, which is your UAP or aide for the day. Sally, I want you to take blood pressures on Miss 4 at 8, 12, and 4. And please report the readings to me no later than 10 minutes after you do them. Only try twice to get a blood pressure. If you can't get it, report it to me immediately because Miss whoever is prone to drop her blood pressure rapidly. And you might say, let's say Miss 4. Miss 4 has a mastectomy on the right side, so only get blood pressures on the left arm. And then at the end of your delegation process, you're going to reiterate. So that's blood pressures at 8, 12, and 4. Let me know the reading within 10 minutes or right away if you're unable to get a reading, only in the left arm. Would you mind repeating that back to me? And that way she can repeat that back to you, and there'll be no miscommunication about what needs to go on with this patient. Okay? Supervision. In the example that I just gave you, you need to be watching the time. And you need to go looking for this UAP if she doesn't bring your information on time. And if she doesn't, you have to reiterate to her how sick this patient is and how important it is to have the readings on time. And you might even need to find out what's going on. Is she so busy that she's not going to be able to do this? Just evaluate and maybe even get the charge nurse involved if you need to rearrange some patient assignments or whatnot. So just a quick FYI, when you receive vitals from a UAP or an LPN or even another RN, and any of the vitals are out of range, it is absolutely your responsibility to recheck them, okay? Don't send the UAP back to do it again. You're the one that has to verify it. If you send the UAP back, it could very likely delay care to the patient. Get up and go check those vitals for yourself. It's your responsibility. If you don't, it could end up being a big problem for you and everybody else. So evidence-based practice. Anytime there are boxes or articles in your book about evidence-based practice, you need to pay close attention. This is the integration of the best current evidence and practices to make decisions about patient care. And you need to consider, when you're doing this, patient preferences and values. We've already talked about that quite a bit. You need to consider your own clinical expertise as well for delivering the optimal health care. Do you know what you're doing? Are you guessing? Do you need further instruction yourself? Okay, quality improvement. All healthcare facilities have a quality improvement program, as we've discussed. As a nurse, you should know what they are in your facility because there will be a portion of it that you're required to participate in. Okay, so like for instance, in the facility that I worked at, we did some evidence-based practice stuff to prevent UTIs, which involved using these special wipes that we bought to clean the perineal area and down the catheter itself all the way to the hub. And so that's how I participated in quality improvement program to prevent UTIs in catheterized patients. Okay, so there are different models or ways to approach quality improvement. There's a plan, do, study, act model. So plan, you find a problem, you analyze it. So we're having a lot of UTIs. Let's study up on this. Okay, so the do is, so we found studies that indicate proper hygiene about the meatus, around the meatus and down the catheter helps decrease incidence of UTIs in catheterized patients. Okay, then we're going to study it. Okay, we started using our new catheter wipes in January. Now it's May. Let's go back and see if it was done correctly, and if so, was it effective? And then act. You're going to implement the new procedure by adding it to the policy and procedures, or if it didn't work, you're going to go back to the plan stage and work through the process again. Okay? Focus PDCA goes into more detail about the stages, as does the newly popular DMAC model. So be sure and read about and understand those processes on page 7 of your book. Informatics is the science of processing data for storage and retrieval, and as a nurse, you'll use informatics and various types of technologies throughout your career. We use it for ease of communication. Several people can be looking at the same chart at the same time. Instant messages or emails helps us communicate information to a large number of people at the same time. We use it to manage knowledge through the electronic health record and also through programs to further our education. So at the facility I worked at, we did ACLS and BLS online on a program. And then we had a dummy that we hooked up to the computer to do the hands-on portion. So informatics helps us prevent errors. Anytime communication is more clear and available, errors will decrease. So support decision making by having information readily available. And that's a big part of informatics. It helps you make decisions about your patients. The more informed you are, the easier it is to make a decision. Clinical judgment. Process used to make decisions based on interpretation of a patient's needs or problems. It involves the nursing process, critical thinking, and reasoning. Okay? So there are clinical judgment challenges or NCLEX examination challenges throughout your book, and I would encourage you to work through them. It's going to help you in your thought process, and that will help you on the NCLEX and also in your nursing practice. So you're going to use the nursing practice. What is the nursing practice? That's ADPI, but we have an OI in the middle of there. That's assessment, diagnosis, outcomes identified / planning. So that's the P part, outcomes identified / planning, implementation and evaluation. Critical thinking and reasoning in this way to make clinical decisions is very helpful. You need to make sure you have the nursing process memorized. It can show up on a test at any time, and you will have questions on your NCLEX that if you can process them through the nursing process, it will help you answer the question. Okay, what does ANA stand for? We've already had this. American Nurses Association. So the attributes that involved that are, I guess you could say, support ethics according to the ANA Code of Ethics. The attributes are autonomy, beneficence, non-malfeasance, fidelity, veracity, and social justice. Okay? We've already discussed all these ethical principles. Review what this book has to say about them on page 9 and make sure you remember what they are. And think about how to apply them. This is kind of a duh slide, but we do need to know and be familiar with what a critical care access hospital is. To be considered a critical care access hospital, you must be located 35 miles away from any other hospital, have no more than 25 inpatient beds, maintain an annual average length of stay of no more than 96 acute inpatient hours, have to offer 24-hour, 7-day-a-week emergency care. So these are your small hospitals, and to be able to, the reason they want to have this title is because of money. They get more money if they're a critical care access hospital. Let's talk about healthcare disparities. Health disparities are the inequalities that occur in the provision of health care and access to health care across different racial, ethnic, and socioeconomic groups. So, according to the Health Resources and Services Administration, health disparities are defined as population-specific differences in the presence of disease, health outcome, or access to health care. And even though the USA is a rich country, especially compared to many others, we still have healthcare disparities today. Some of the causes could be poor communication, healthcare access, health literacy, healthcare provider biases, and discrimination. Other sources name the potential causes as poor access to healthcare, poverty. I want you to think about this. I've been in the position before when I was younger, when I didn't go to the doctor because of money. I had a really bad ear infection one time, and my hearing in my left ear is not good because of it, because I waited so long to go to the doctor just till I absolutely had to, because I didn't have the money to go. Okay. Also, health disparities can be caused by exposure to environmental problems. This could be things like pollution, unhealthy living conditions, eating a poor diet that's full of cheap carbs with very few fruits and vegetables, which leads to obesity. Okay? Another cause of healthcare disparities can be inadequate level of education. So think about this. If you can't read or write, you are much less likely to be able to take care of your health. Okay? These aren't people to be looked down on at all. We as nurses have to find a way to help these people, many of them who are very, very proud, good people. We have to be respectful and gain their trust and help them take care of their bodies as best we can. Okay? So there are also some individual and behavior factors that come into play in healthcare disparities, like unsafe sex practices. And President Obama went to Africa one time, and he and his wife went into a facility that did HIV testing. And the reason they did that was so that they could set an example, because at the time over there, they were not, especially men, were not wanting to go in and be tested. They thought it decreased their masculinity or something. So President Obama was trying to set that good example to have them go and be tested for HIV. Okay, so this is your assignment for this video. And I'm pretty sure that this link will not work in this form that it's in. So you're going to have to copy this down and put it into your phone or computer browser. And the link will take you to a series of questions that you need to answer. I think there's only 3 or 4, so don't get too upset about that. Now, those questions I will see. It will send me a report when you have answered them or if you did not answer them. So you do not have to print those off and put those in your notebook. Just answer them online and I will be notified.